Hello, folks. This is David Villar, Professor of Pharmacology and Toxicology. Thanks for tuning in to this presentation, which is going to be about a peculiar toxicant that only affects dogs, which is xylitol. Now, the word xylitol comes from the Greek, which is wood plus sugar alcohol. This is actually a naturally occurring 5-carbon sugar, which is present in fruits like plums, pumpkins, strawberries, and it's used as a sugar substitute or sweetener in drugs, dietary supplements, toothpastes, chewing gums, breath mints, and as you can gather, it's what diabetic people will use to replace sugar or glucose in their diet. It is also sold in the bulk form for baking purposes. So if you see something that says sugar-free, you should probably not want dogs coming near any of these products. Now, with regards to the toxicity, it's usually hard to calculate the dosage ingestion because we don't always know how much is present as xylitol because there could be other sugar alcohols like mannitol and sorbitol. So it's actually difficult to estimate the total xylitol content ingested in dogs. Now it's basically non-toxic to mice, an LD50 of 20 grams per kilogram. It's also non-toxic to people. You will need dosages of up to 120 grams a day to develop just the diarrhea. But in dogs, the story is entirely different. Levels of 0.1 grams per kilogram, which is 100 milligrams per kilogram, they can develop a hypoglycemia in just 30 to 60 minutes of the ingestion, which would be reflected as an animal with lethargy, ataxia, collapse, possibly convulsions, hypokalemia, hypophosphatemia. And what happens in dogs is that the body will consider xylitol the same as glucose, and that will cause the release of insulin in the pancreas and will drop the glucose levels to the point of producing potentially a severe hypoglycemia. Now, there is another syndrome which is reported at levels of 0.5 grams per kilogram or more, which is an acute liver failure in 9 to 72 hours of the ingestion. And this may not always go associated with the hypoglycemia. So we cannot really rely on glucose levels to say that the animal will not develop an acute liver failure. Now let's look at a couple of papers. This one was published in 2015. It's a retrospective evaluation of xylitol ingestion in 192 cases in 3 teaching hospitals. The medium ingested of xylitol was 0.32 grams per kilogram with 39 dogs, which is basically 20% of the animals showing clinical signs on presentation to the teaching hospital. The median duration of clinical signs prior to presentation was 93 minutes. And the good thing was that all the dogs eventually recovered. So as we will see in a minute, if they don't develop liver failure, the prognosis is actually pretty good. As we can see on this other table, the most common clinical signs was vomiting in 25 dogs, followed by lethargy in 12 dogs, diarrhea in 6%, ataxia in 5 animals, and convulsions in 4 dogs. It is not mentioned in these tables, but 30 of the dogs became hypoglycemic at some point during their hospitalization with levels of glucose below 60 milligrams per deciliter. And they mentioned that the dogs which developed clinical signs had ingested a significantly higher estimated dose of xylitol than those that were asymptomatic. Now, if you look at the table on the right, the treatment of xylitol ingestion is basically symptomatic, as with most other toxicants. Apomorphine can be used to induce vomiting if the dog had not already vomited. If the animal is showing clinical signs, inducing emesis would be contraindicated because of the risk of aspiration pneumonia. And because xylitol is absorbed very quickly and hypoglycemia can occur within 30 minutes of the ingestion, the window for safe decontamination is actually pretty narrow. Activated charcoal is not very effective because it has been shown that it will not bind xylitol very well, maybe 10 or 20% at the most. And other supportive measures include liver protectants and dextrose supplementation. They mentioned that doing serial serum biochemistry panels should be performed from the admission to at least 72 hours after the ingestion. And if the liver enzymes go up at any time point, they should immediately start with liver protectants right away. Now on this slide we summarize the treatment protocols. Emesis if the animal is asymptomatic. As we said, activated charcoal does not bind xylitol to make a recommendation for using it. Ideally we should hospitalize the dog and obtain a baseline glucose levels together with some potassium and phosphorus, and also looking at those liver enzymes. An indication that the liver is failing could come from doing coagulation times measurements. The glucose should be measured for 12 hours and the other parameters for at least 72 hours. Now the treatment includes giving boluses of dextrose if the animal develops hypoglycemia. Those fluids need to include potassium because insulin will cause potassium to go down in serum. And finally, provide some liver protectants and even plasma transfusions if the clotting times go up. Mild increases in liver enzymes usually resolve within a few days if we provide with supportive care. And on the other hand, if there is a very severe elevation of those liver enzymes, high bilirubin and some coagulopathies, then the prognosis is actually pretty poor. Now let's look at one case in more detail. This is a 5-kilogram Chihuahua that ingested a whopping dose of granulated xylitol of 24 grams per kilogram, and he started vomiting right away and he was taken to a veterinary clinic. On this slide we see the results of the blood work at different time points after the presentation to the veterinarian, and I have included below how he was treated along the way. So as we can see, the initial diagnostics showed hypoglycemia of 60 milligrams per deciliter, a mild hypokalemia of 3.1 milliequivalents per liter, a mild increase of liver enzymes ALT at 200, and an increased total bilirubin. So at that point he was given meropenem as an antiemetic, metronidazole, and a liver protectant, which was adenosyl methionine, and obviously some fluids with dextrose. At 12 hours of the treatment, he was what they did was adding N-acetylcysteine, which is another liver protectant, and as we can see, the ALT increased to 2,200 units per liter. And in addition, there were other enzymes that were also elevated, like GGT. And because of the increased liver enzymes, they started looking at coagulation times, which were basically prothrombin time and partial thromboplastin time. At 24 hours of the ingestion, a coagulopathy had developed with a PT of 62 seconds and a partial PTT of 125 seconds. The liver enzymes remain elevated with ALT of 2,000, GGT of 15 units per liter, and there was also an elevation of total bilirubin of 1.1 milligrams per deciliter. So at that point they started using fresh plasma to replace those clotting factors. At that point the dog developed mild facial edema which resolved with the administration of the antihistamine diphenhydramine. The results of giving fresh plasma is that the clotting times were within the normal range at 36 hours. However, they mentioned that the animal developed ecchymotic hemorrhages along the venipuncture sites. Over the next 36 hours, those hepatic markers improved, and when they were still elevated above the normal reference values. So they continued with the same medical treatment, and the dog actually made a complete clinical improvement. and he was discharged from the clinic 5 days after the presentation. All the liver values were repeated at 1, 3, and 7 months later, and they were all within the normal reference range. So what can we learn from this case? Well, basically, apart from the hypoglycemia that can happen within the first few hours of the ingestion, we have to always keep in mind doing liver enzymes, which can also start increasing within hours, and they can remain elevated for several days. If those liver enzymes are high, it is possible that the animal will develop a coagulopathy, which needs to be addressed with fresh plasma and liver protectants. In this particular case, ALT levels rose within 12 hours, and they peaked at 1 and 2 days before they started declining, which is obviously a favorable sign. And because there is no specific antidote for xylitol, the general treatment guidelines are basically to treat the signs, vomiting, stabilizing blood glucose, protecting the liver, and obviously addressing any coagulopathies as needed. So even when xylitol is potentially life-threatening, it may be successfully treated with aggressive therapy, as we just saw on this particular case. So this is the final slide. I also wanted to show you another paper in which 8 dogs were not as fortunate. They actually developed an acute liver failure and a coagulopathy with xylitol ingestion, and they eventually most of them, all of them, ended up dying in spite of the treatment. So thank you guys for tuning in to this presentation, and I will look forward to seeing you on other ones. Take care. Bye bye.